Welcome back to Shifting the Scale. Bariatric surgery isn't the only option to lose weight, with a lot of medications for that purpose recently hitting the market. And I want to ask Brenda this question: what determines if someone is eligible to get injections to help lose weight?
So there are a few things we look at. The first question we ask is if they're diabetic. Now, the GLP-1s are obviously used to treat diabetes, but we don't manage that in our office. So for us, it would be if you're diabetic, we would say we'd refer you back to your primary care provider. We also look at what we call contraindications, and there's really two that we always ask about. One is if they have a personal or family history of medullary thyroid cancer, or a personal or family history of multiple endocrine neoplasia type 2. Those two things would definitely be a reason that somebody would not want to take the semaglutide.
For the patients who do want to take part in a medical weight loss regimen, what are some of the common lifestyle changes that they'll need to make?
Absolutely. We do talk a lot about this medication as a tool. It's used to help jumpstart their weight loss. So we talk about while they're taking the medication, we want them to work on making those positive lifestyle changes, which include plenty of fluids. 64 ounces is kind of the magic number we talk about with bariatric patients. I also recommend just a complete multivitamin to help fill in some of the cracks. And then the big ones are definitely making good dietary choices and then increasing their activity and exercise.
One thing I think we need to address are any possible side effects from a medical weight loss regimen. What side effects are there, and how does CNOS help manage that?
Sure. So we can see a couple different things. Overall, the medication is really well tolerated by most people, but we do have occasionally people say they get headaches or fatigue, dizziness. Those typically I tell people, look at when was the last time you ate or last time you drank. With this medication, you get the appetite suppression, the food noise is quieted, and it's not unusual when they get to a dose that works for them that they're going to get busy and forget to eat. Really? Yeah, so I always say if you start feeling kind of crappy throughout the day, just think of the last time you had something to eat or drink. That's the first thing that I do. And then because this medication works on our GI system, it slows it down to help us feel fuller longer, we can get some GI side effects. We do see some constipation, which again is easily treated with over-the-counter medications. Occasionally we see some diarrhea and vomiting, not very often. And again, that can be treated symptomatically. We do get some nausea, some patients that complain of nausea, and we give them some recommendations of how they can treat that at home. Big one is probably just eating their food slowly. Because we're slowing down that GI tract, and if they eat too fast, they keep compounding what's already in their stomach. And the last one we see occasionally is bloating. And as far as recommendations for that, we say stay away from carbonated beverages and then drink between meals so that at meal times you fill up on healthy, nutritious food and not add to the bloating effect with all the fluids.
All right. Thank you, Brenda.
Yes.
All right, a common phrase, of course, preparation is key, right? Well, this question is for Megan. What type of preparation is needed before undergoing bariatric surgery, both physically and mentally, Megan?
Yeah, so as Brenda was saying with the GLP-1 or semaglutide, weight loss surgery is also just a tool. So when we are working with patients to get ready for the surgery itself, there's a variety of things that we're trying to prepare them for. I'll start with the mental side of things. So mentally, as Dr. Hegvik mentioned, we are having the patients undergo a psychological evaluation to not only make sure that they are ready to make this decision to have surgery, but also that they're prepared for the stressors that are going to come. As patients are going through the educational program, we've continued to add more and more mental health aspects to the program itself. One of the big ones that we talk about with patients is eating triggers. Why do we eat? You know, we eat for hundreds of reasons in our society, and being hungry is one of them. So we know the surgery addresses physical hunger really well, but it doesn't address the emotional eating and the social aspects. We also talk a lot about support systems. We hope that all patients have a really good support system as they're going through the process. And, you know, if not, we want to be able to give them as many resources as possible because this is a life-changing event and support is everything for that. Physically, there are just as many changes that we are preparing the patients for. And I think a lot of people think they're coming to meet with a dietitian so that I can tell them how to eat. And although we do go through that, it's more of physically, how are they going to eat? This surgery definitely changes some of the dynamics in how the digestive system works. So we are looking at more of eating techniques, as Brenda mentioned, eating slowly, chewing thoroughly, not drinking with meals. These are just some of the things as patients are going through the classes, we are having them week by week really dive into not only why these lifestyle changes are important, but how they're going to do them, how they're going to pull them off on a logistical basis.
Okay, and while we talk about lifestyle, are there specific lifestyle changes or diets that a patient really should follow leading up to surgery?
Yeah, we have we have all patients follow a 1-week pre-op diet. Okay. But again, the big thing for patients is looking at their lifestyle on a day-to-day basis. I don't want patients to go on a strict diet prior to surgery, but really look at, what do I eat on a day-to-day basis? How could I be making practical changes to the diet? We want them to be able to stick with this diet for the rest of their life. So again, in that week leading up to the surgery, we have patients follow a special diet that helps their digestive system get ready for the surgery itself. Okay. But in the classes and in leading up to the surgery, we're really just focusing more on healthy lifestyle, making sure they're consuming adequate protein, knowing good beverages that they can drink to keep them hydrated, and really starting at the meal planning, grocery shopping processes so that they already have their day-to-days and household set up for what's coming with the surgery.
Because again, it's a lifestyle change, not a quick fix.
Absolutely.
So, all right, preparation is key.
Yep.
Thanks, Megan.
Yep.
Another question for Dr. Hegvik. We touched earlier on about how long the 2 different surgeries that you perform take. What can a patient expect during surgery? How is the surgery done? I know you get a little high-tech help here.
Yeah, so I do both of these minimally invasively. The sleeve gastrectomy typically is done laparoscopically. We do our gastric bypass robotically, and mostly the reason for that is the ability to sew inside the abdomen is so much nicer with the robot, but both are really are nice operations that we can do with little incisions. That's the main thing. What
blows me away is that there's so many little, you call them wristed instruments on the robot, the Da Vinci, where it actually can do that sewing.
Yeah. Yeah, and it's a fun part for me as a surgeon to get to be able to do that and use that technology, and it's made that operation a really a nice, enjoyable one.
I know you joked, you know, people have asked you, what do you do during the surgery? Oh, you go have a cup of coffee, which is not true. He's actually in the surgical suite. You're just a couple of feet away.
Yeah, we get to sit over there, and the ergonomics are really nice. We're like you said, just a couple feet away from the patient, but. Yeah, it's really nice technology.
So here's a 2-parter for you. Where are these surgeries typically performed, and how long do patients usually stay in the hospital after surgery?
So we do our weight loss surgery at the Dunes Surgical Hospital, which is in Dakota Dunes, right next to Sioux City. And our sleeve gastrectomy is actually, for the last about 1.5 to 2 years, have gotten to go home that day. There's a couple criteria that we use. We want them to be under the age of 65 and a little bit smaller BMI. They get to go home that day, which is really nice. And my gastric bypasses, I usually keep in the hospital 1 night.
Okay.
But of course, if there's anything that we need to do, we can keep them overnight longer if we need to.
Very good. Thank you, doctor.
All right, we're going to continue our coverage with lifestyle. This is the big topic. We have a question coming in tonight from a viewer. This is for Megan. Can you tell us about the best lifestyle changes to help us be successful in losing weight and then keep it off? Even after surgery, how do you stop your bad habits and keep all that weight off?
Oh, such a good question. So I think the big one at the end of the day is patients really being practical. You know, in our diet society today, diets don't typically work well for the long haul, and it's because a lot of diets are really based on very restrictive eating. So again, when we're working with patients, we're really looking at what are you doing from a day-to-day basis instead of wiping the slate clean and starting from scratch. If we can get them to make more manageable changes on their own, we just see longer term success, and it doesn't seem as daunting, right? If you're starting a diet, I'm kind of telling you all the things you need to change overnight. So we really like to work at more of a long-term approach, and I always tell patients, if we can prioritize our nutrition and focus on moderation and not be so restrictive, it's just a happier way to live. You know, nobody wants to eat a restrictive, boring diet for the rest of their life. So I can't think of any food after weight loss surgery that I would tell a patient they can't eat. I don't want them to eat cake every day, but if they're at a birthday party, I expect them to have a little slice of cake with their family. So focusing on that, I think, not only makes the patient mentally happier, but it's just more realistic to stick with.
I don't want to eat lettuce every single day, Megan.
No, me neither.
All right, great response. And all of you, we want you to weigh in. We want to hear your questions. So if you have a question for our panel tonight, go ahead and send it on over to connect@ktiv.com. We'll try and get you an answer before the end of the show.
Time now to take another break, but of course, more from the panel coming up.
In the next segment, we're going to look at the recovery process from surgery and post-operative care. Shifting the Scale returns in 60 seconds.